Good evening, doctors, practitioners, CAs, and everybody else out there. We enjoy having you together tonight and to listen to Dr. Harper. I wanted to kick this off a little bit. Dr. Harper took a class for me. This is Dr. John Brimhall, maybe 15 or 20 years ago. And then we kind of went our own separate ways. And now I'm back taking classes from him with his innovations as a chiropractor in Idaho. They can do injections. He's also a naturopath, and his list of accomplishments is pretty amazing. And you hear, I spent about 3 or 4 weeks ago, he had a seminar here in Phoenix, and I went and attended it for all 3 days. And I saw him unravel 3 patients that were absolute miracles, and probably 7 patients were dang close. And evaluate. One girl had literally fallen, her lady had fallen off a ladder, but not all of her fell. Her foot hung up. And she had been for 7 years in chronic pain. She'd been seeing medical doctors. She'd even seen a medical doctor that does some of Dr. Harper's work, and she had only got a glimpse of any help. So he does his 3 to 5 minute exam, and that's very, very impressive. And I want you guys to all learn that someday. Watch him in action. And he figured out that he had torn the internal pelvic muscles, and literally before our eyes, with chiropractic, PEMF, and some injections to help reestablish using ozone and stem cells were indicated, etc. Literally, she went to much more of a pain-free lifestyle. Her walk, her gait improved, and it was very impressive to say the least. And that was probably the most dramatic, but there's many others like that. I'll let him tell more about it than myself. But then I had him come to my office a week and a half later, and literally I hired him for a day. And this is a pretty exciting thing to do, and I highly recommend you do this in your office, particularly if you want to do integrated healthcare, integrated medicine, where you're working maybe with a medical doctor, a naturopath, a nurse practitioner. He really knows how to get these instituted in the office. And a lot of guys that are in integrated practices try to do everything themselves. But I would say watching him work, of course, he married his best manager in the world, Shirley, and she keeps him streamlined and going. He's seen anywhere from 50 to 90 patients in a day and have it streamlined where it's functioning. They're getting everything that they need and literally transforming them right before your eyes. So glean from this, number one, if you have any interest in having an integrated practice, you need to come and watch him in action. Watch Dr. Mark Harris in action, because these guys are geniuses. They've had thousands of patients under the belt, and they can show you how to do something as simple as an ozone injection or a pleb to kick the adrenals back on, along with the OHS nutrition that we use. But I could go on for an hour. We're not to give him any time, but I can't say enough good about what he can do, his ability to evaluate and then treat what he sees. Dr. Harpers, share your talent with us, please.
Well, thank you, Dr. Brimhall. I want to meet this guy. Sounds pretty awesome.
Yeah.
So it sounds good. So I'm going to rock off here and go and welcome everyone. It's a pleasure. And I got to tell you that my inspiration actually was Dr. Brimhall going back 20 years ago. And he's gave me some of the tools to be able to expand on and been around the block. And so let's get right into things now. And just so you know, by the end of the conversation, you'll be able to get a web introduction to our Harper Restoration site, which will give you a login to see about 68 videos we have on there. And we're loading 10 other videos on in the next week. So all that'll be available. So let's go through what I've got here today and give you a little introduction. So my disclosures I talk about of people I work with are multiple. If I can get this to work here, there we go. We use PEMF machine, Harper Restoration System I work for. Airtight supplies a lot of our products for us, our syringes, needles. Longevity is the ozone machine we use, which is probably one of the better machines in the United States unless you go to Germany. Results RNA helped us build a product. We use some of for our injectables. Diversity Biological Signaling Systems is DBS, and that group is Jolene, and that supplies the biological allograft, which you'll hear as stem cells, but for simplicity, we'll call biological allograft stem cells. Utah Cord Bank we work with there in Utah, where we get some of our cord bank materials. And the talk we're talking about is turning degeneration into regeneration. And that's me standing in the mountains near Orofino, which is where I get a lot of my inspiration from. I call it dirt time. I love to hunt and fish. Credentials. We've trained over 300 offices to use IV, ozone, and injections. I teach 10 to 15 classes a year on ozone, biological allograph, CLOT matrix, and PEMF machines, which is pulsed electromagnetic frequency. And I do a lot of research in using new products for IV and injections. And I've done over 25,000 injections myself in the last 10 to 12 years now. 38 years in practice. I started originally in 1980, graduated Western States, and been in Idaho ever since then. And I also won the Idaho State Elk Bugling Championship about 10 years ago. So on to work. Items to cover. Regenerative medicine in your office. Now, you hear that buzzword a lot. What's regenerative medicine? What is integrative medicine? A whole bunch of buzzwords out there. We're going to call it regenerative medicine right now and build on that. And I'm going to talk about synergy, because one thing that I feel real fortunate about is the education I got in chiropractic college in the 70s from Western States. We did OBGYN, proctology, minor surgery. We did blood work. We did lots of things. And I also learned how to adjust. I actually did 12 Gonstead seminars before I got out of school, and actually got to meet Gonstead and work with him for a day, which was an amazing experience. But the trick is integration, and Dr. Brimhall mentioned this, is learning how to make everything dance together, and that's the synergy we're going to talk about. And where to move your practice in the future. I'll talk a lot about building boxes, and I talk about being in practice and building a box. And a box is a set of tools that you use. For instance, you have a chiropractic box, how you adjust. You have a box of how you do exams. You have a box of therapies you use. You have a box of nutrition you use. In our case, there's a box of injections we use, and IV work we use, and the biological allografts. So you got to determine what boxes you want, and then what practitioners make that box work for you. I have an MD in my office that does all of our hormone balancing. So he works with pellet implants, he works with tropes, he works with any other testosterone injections, he does allergy work, he does low-dose antigen work. That's a box for him that he does. And so that's how you can build your boxes. Ozone and biological allograph in your office. It can be a small area, 10 by 10 foot area for injections, IVs. I really tell doctors, train your staff. And Dr. Brimhall mentioned this. We go to offices and spend a day and a half in an office. We make sure that staff is well trained also. If the staff isn't well trained, they'll actually torpedo anything you're doing. Informed consents, we talk about that. We have those listed. And we talk about checking with your malpractice carrier. That's another discussion we can have later. But for chiropractors or MDs, you can find using stem cells and injections. In some states where it's in the scope of practice, it's already covered with malpractice. If it's not, you can have a rider put on. Our MD only pays $700 a year for his malpractice insurance. He comes 1 day a week. And he's licensed under that to do biological allograft stem cells and any of the injections. Safety rules are important. I'll talk about having OSHA come into your office just to check the safety of your office. And this is what we use here, very simplified format. And you can see the small little box here. And it's really nice because as the oxygen tank here, our ozone machine here, needles, our sterilization tools here, a tray to put products on, and a bench. 10 by 10 foot area, very easy, very clean. And this table is an $85 microwave table from Amazon. Ozone vitamin injections are safe, simple, and effective. They produce consistent results and 80% effective when diagnosed properly. And that's where Dr. Brimhall mentioned the exam procedures. I'm a stickler for exams. I've had numerous people come in that have exams or not had exams, had injections in the wrong things and wondered why it didn't get any better. So realize that's important. Ozone has negligible side effects. Millions of procedures have been performed, used in Europe for 150 years. These are some of the things we've treated in our office successfully: endometriosis, Paget's, Osgood Slaughters, rotary cup tears, arthritis in the shoulders, hips, cartilage, ganglion cyst, hammer toes, trigger fingers, neuromas, tendinitis. I'll just read through a bunch of them. You can see them here on your presentation. Carpal tunnel, chronic sinusitis, fracture sites. We can inject into a fracture site and stimulate new bone growth quicker, especially in a non-union fracture. Open wounds, warts do amazingly well. Ozone itself is a natural antibiotic, antiviral agent, and it can kill viruses. You shoot it right on a virus, it will kill it. A neck injection to see what it looks like here. You can see the vitamin mineral mix we use here and the ozone we put here. And if you look at the needle here, we can see the penetration of 1.25 inch needle is nowhere near the spinal column at all. It's underneath the interspinous ligament, and it affects the function and range of motion of the joint. So injections that we use are sort of like using chiropractic. They stimulate the reticular system. They cause an increase in range of motion. They cause increased nutrition into an area. It breaks down scar tissue and causes healthy stem cell production of your stem cells, which causes healing, increased range of motion as chiropractic does, and you can get disc resorptions that are herniated. You can get facet improvements. You can get chronic arthritis to settle down and heal. Now, we did this under fluoroscopy, so you can see this. A needle placed posterior to the interspinous ligament, and it's too shallow. We notice here we place the needles deeper. These are 1.5 inch needles. You can see they're in about 1.25 inches there. There's a very, very thin stature, the individual. And you can see we put dye in with this, with our mixture. In this case, we used a cocktail using biological allografts or stem cells with some of the patient's blood as a PRP with ozone, and injected the ozone. You can see it spreads dramatically over 4 segments, which will totally affect the changes in the cervical spine function. This patient had chronic arm pain for years, 25 years of neck pain. Within 3 days, he said his neck felt better than it ever felt in 25 years. So realize you can see changes like that that you can't get to otherwise. Now, this we look at just basic cases we've seen in the office. This is a 76-year-old male. You can see the degeneration on the knee, right knee. He has the left knee replaced, which looked this bad 9 months before, was scheduled in September of 2009 for this knee to be replaced. We did 2 injections with ozones, vitamins, and minerals. We re-x-rayed in May 2010. You can see that we have space back in the knee again. No pain. You can see the arthritis cleaned up here has gone away there. And he lived another 3 more years with no pain in the right knee. Had more pain in the knee that had surgery than in the knee that was supposed to be replaced. I had him go in July of 2010 and have his orthopedist x-ray it, put up on the wall, looked at it, said, "Oh, it got better. That happens sometime." Threw the x-ray down and walked out of the room. So we rock lots of heads when we do these kind of changes. This does not happen all the time. We've seen on x-ray at least 20% of the time. So it does happen. So what's the true challenges in anti-aging? One is the FDA. I'm going to talk a lot about that when we go into utilization of ozone. And I do a complete presentation on ozone. Now I'm giving you just a brief over on ozone. But the FDA considers ozone a poisonous gas. Now, in utilization, oxygen's poisonous if too much of it's used, and so is water. So if it's used in the right doses and the right utilization and good sterile machines, it's a very good adjunct to any treatment you do. But so the FDA is also on its offensive now with stem cell clinics. And I'll talk about that as we go along. So that's why we want to dodge that bullet, and we go to what's called biological allografts. So keep that in mind. And the goal is to get oxygen to healthy cells. We know that a healthy cell will die without oxygen. We know that oxygen actually will kill cancer cells. So oxygen to the body is a huge help for regenerating the body. And we want to stimulate healthy cells to outstrip old sick cells, because we know right every minute we're sitting here, we're losing 300 million cells per minute are dying. So we obviously want healthy cells to replace those. And how do we keep up? I always show this picture of me packing out my moose antlers. 3 years before, I never could have done this. And I did this, this was 3 years ago. So 6 or 7 years ago, my left knee would give out going downhill. After several injections, I was able to pack those antlers out. So it's always, to me, the reason I do this stuff is partially for myself. It's kind of selfish, but I try everything on myself first.
Hey, Doc, tell them what you injected in there.
What type in there? We used ozone and vitamin minerals on the knees, and then eventually used the biological allografts on my knee and hip. So we've experimented with lots of things over the years to come up with the formulas we're using now. This is ozonated clot matrix. If you're familiar with PRP, it's a form of PRP that we ozonate, and we mix that with the biological allograft stem cells to inject into joints. It gives us a lattice, so we have a factory to form new healthy cells in your body. And this is evidenced by Martha Murray, who's an MD, Boston Children's Hospital. And they actually go into torn ACLs that are totally avulsed, put a sponge in, inject the clot matrix into it, and are finding that the body's actually restoring those fibers and reaching from the superior inferior aspects of the ACL ligament to reform them. So pretty amazing innate abilities the bodies have if we give them the tools. And part of the tools is the ability to form healthy stem cells to regenerate the body like new again. So realize we're always trying to regenerate the body like new again. So I'm going to talk about biological allograft. I've mentioned it. I want you to understand it. You're going to see them advertised as stem cells. You'll see stem cell salesmen. You'll see articles. You'll find YouTubes. It's all over now. And what I want you to understand is tissue viability and why more cells, CCs, may not be better. And I say that because you'll see salesmen telling you that one CC has 3 million, 5 million, 10 million, a billion. They'll tell you all sorts of things. The problem with that, when you extract tissue, and just so you realize this tissue is from a C-section delivery, screened pregnancy that is tested to the same quality level as a transplant heart or liver or kidney. And they're sterile tissues. And what they've taken out of those tissues, they take it from a little bit of the blood, they take some from the cord and some from the amniotic tissues. And what it is, it's tissue that is the spark of life to make your stem cells act like brand new. And there's exosomes in there, the cytokines and thrombocytes. So your body, if you take someone else's stem cells and put it into yours, your body will metabolize those. And what they do is they take the juice that's out of them, the soup that's out of them, to stimulate their own stem cells to act like brand new. So realize that's what you're doing in the system. You're using a soup or a biological allograft from C-section deliveries to stimulate your stem cells to act like brand new. So the next question is the best delivery systems. We've seen them used for IV and for injections, for a knee joint or for an IV for cardiovascular disease, for kidney failure, for liver failure, for heart failure. We've seen great results with those kind of things. You're going to find a lot of debate on bone and fat. And Dr. Brimall will make available to you, or surely will, an article written by David Harrell, and I got part of it quoted here in this presentation. If you take, and this is the best demonstration, I guess, right here. At birth, one of your healthy stem cells will produce 1 billion healthy cells a month. By age 30, it'll produce less than 30,000 a month. and by age 60, it'll produce 200 cells a month. And so we want to activate the body's own stem cells to regenerate. Can I have some water, please, Shirley? And again, I'm saying 300 million cells die per minute in the body. Thank you. And the body rebuilds itself in 5 to 7 years. So if we go back to those numbers again, and if you're age 70 and you want to pull fat out and take stem cells out of your fat, you have no idea how many of those are actually MSC cells, which generally from some of the studies, it takes about 6 months to figure out how many are MSC cells, usually it's less than 3%. But if you're age 60, you're producing 200 healthy cells a month. Why not take biological allograft material and produce 1 billion healthy cells a month from one of your stem cells? And so if you get 300 million cells that die in a minute, and your body rebuilds in 5 to 7 years, and we can put enough stimulation in a biological allograft, why can't we build your body back to age 25 in 7 years? That's the question. So let's go on with that. The Food and Drug Administration, again, is our nemesis here. And they regulate the tools used in medical practice, cells, and tissues. The tissues we get are transplant-level quality cells from a lab that's approved by the FDA for transplant-level cells. I'm going to tell you they frown on doing IVs, so we've got some easier procedures than that to do with what's called a brown fat injection. We use them for joint injections, which is transplant-level materials, so we feel confident with that. And I won't go through the rest of this article, and we'll get this handout to you from Dr. Harrell, which will explain this even clearer. MSC stem cells to be or not to be. If you look at Kaplan's work right now, he's saying he probably misnamed MSC cells as stem cells. So there are no known markers that can identify pure stem cell populations. So realize if you're getting companies that are counting cells, they're cells. It does not mean they're stem cells. And the FDA actually says that if you're injecting if you say it's stem cells, it's got to be pure stem cells. The next issue is if you're taking these cells and expanding them, putting them in petri dishes and growing them, taking parts of them out and culturing them, you're manipulating them. Manipulated cells are also not legal to use in the U.S. So realize they have to be minimally manipulated only to be able to be used. This is just a little bit of stuff that's out there, and this is by Mayo Clinic. And it kind of tells you that they believe also that they're talking about MSC cells, but are the things that could be what cures many things in society. In 2003, it was $128 billion spent on arthritis. In 2016, it was $800 billion. So if we can treat these things more effectively and efficiently and save money, we're going to cut those costs of healthcare costs down. Probably the biggest thing is if you took 100 knees that were going to be replaced and could treat, and that cost you $50,000 a knee to treat, you're going to spend $5 million on replacing 100 knees. If you took and treated those, say, for $200,000 with using ozone and some of the biological allografts for $200,000 and save 50 of them, that's a $2.5 million savings. So a lot of procedures we're doing, we can eliminate a lot of the healthcare costs. So tissue turnover, cells are programmed to die. Normally, your cells are supposed to die, but you want it to be replaced. And stem cells are the engine of regeneration. There are little vesicles on MSC cells that produce a lot of little things that go out there and make your body produce healthy, brand new liver cells, heart cells, lung cells, nerve cells, cartilage cells. All the cells of the body come from that engine. Sources of stem cells, there's embryonic stem cells, placenta cord, and adult stem cells out of organs. Bone marrow, blood, fat have stem cells in them. So we want the best, healthiest stem cells we can get, or the precursors to stem cells, or the results of stem cells, which is our soup that comes from the biological allograft. Now, adult stem cells can be harvested from a patient, but if I take a 70-year-old and I take bone out and spin down and take what I think are stem cells out of bone, they're going to be at the productivity level of 100 cells a month of healthy cells. So do you really want to stick that back into somebody? Or fat's the same way. Do you want to take fat out and use that on a 60-year-old? I want to get biological allograft tissues that are brand new that will produce 1 billion healthy cells a month. So keep that in mind. And the other concern is if you're going to extract fat and or bone, you have pain, infection, contamination, and limited potential. They're tired cells. So again, I'm at the FDA again. A biological allograft is used to engage a patient's own dormant stem cells to cause a dedifferentiation of their own cells to act like new. And we got to ask if MSCs are real stem cells. And you got to be careful using products from labs that have pure cord blood that have protein markers that your body will act improperly to. It's like putting a bad liver in and it gets rejected. And many labs are approved for FDA transplant level purity, but at present there's no procedures that are FDA approved. Realize if you take bone and fat out and you start taking and expanding that and putting in petri dishes and making things out of it that and then start with and use for a specific purpose, it's then called a drug by the FDA, which is illegal to use without having all the data from the FDA to say it's a drug for a specific symptomatology or procedure treatment. So how do we make this thing work together? We want a cascade effect. We want to start a stimulation in your body that starts regenerative things to happen and give the nutrients to it to make it happen. We want to sustain the action of the cellular activity. We want to make sure that your body's charged up well enough to do it, whether you're using a pulse magnetic frequency or your laser or your nutrient IVs. You need to sustain that action ongoing. It's not like a one-time treatment. Here, I'm going to give you a boost of these stem cells and put you on a machine once and you're brand new. Your body's constantly regenerating. So we want cellular activity ongoing. And we want to learn more about the benefits from biological allografts. These are some of the things we've seen results with using biological allografts. We've seen Alzheimer's, anti-aging, cardiovascular, arthritis, and that's rheumatoid and osteoarthritis, MS, cerebral palsy, COPD, asthma, kidney failure, Lyme's, and the possibilities are out there for what we want to see happen. If we regenerate the body back again, we can fix a lot of things that are not just genetically displaced. So when we talk about this, and if I'm talking to mainly chiropractors here, which I possibly am, or a medical doctor, realize that a multidisciplinary office or exposure to that builds a lot of win-win situations. And it gives patients a true healthcare option. They can have all those boxes I covered earlier dealt with. And you learn how to delegate to build these boxes. So things to check is real simple. State laws and rules, type of practitioner. Different laws are different for different practitioners in different states to a degree. For instance, a nurse practitioner in about 47 states does not have to work under a medical doctor. In 3 or 4 states, she has to. We have naturopaths that are licensed in about 18 states and have a full range of ability to prescribe. We have some states that chiropractors can do some injections. In some states, RNs can work for a nurse practitioner. In some states, they can't. So you've got to realize how we're using LPN, a medical assistant, or chiropractic assistants. Physical layout of your office, you want it where it flows. Our busiest day last year, we saw 90 people in the office. I had one doctor working here part-time with me, another chiropractor, and I have 6 staff people, and we have a 2,100 square foot office. Small office, people move from room to room as they need and rotate through the system as needed. Legal structure setup, we'll talk about briefly. Payment systems, we use cash practice. I bill Medicare for chiropractic adjustments, that's it. I've treated these patients for nearly 40 years now, a lot of them. So I do accept Medicare for those patients. All the other services are cash practice. Staff training is important, computer or not. You virtually could run a cash practice with this and not even put things on a computer with this type of service. So that's an option you have to do or not to do. And again, check your state laws. There's things you can do and not do. There's also restrictions in some states on hiring certain practitioners and not hiring them. So you have to check that. Ownership in offices. In California, an MD can't, so you'd have to be an MD to own an office, and non-MD can't. In Idaho, anybody can own an office and hire an MD. So know your board members, become involved in state politics. And again, just a little bit of a precursor, or adjunct to what I said before. We have fellowships that dictate practices, types of practices. Naturopaths, we've covered that. RNs, LPNs, MAs. Surely, as Dr. Brimall mentioned earlier, is an MA. In Idaho, our MAs can do anything but adjust patients. Office layout. We had OSHA review our office for safety. OSHA is only to protect your staff. And it's a nice stamp on your office, say we're OSHA compliant. And it doesn't cost you anything. They'll come through and help you out. It's better than having a complaint. Needs analysis of the procedures. I tell the doctors to go through and actually see how profitable each action is in our office. Their adjustments, how much time they take, how much their exams take, what their staff cost, what their per hour cost of doing procedures is. Now, you may need a hood in your office if I be mixing over 2 to 3 items. Check your state laws on that. We'll talk about that later. And if you want to use biological allografts and stock many products, you need a freezer that goes to 80 below. We don't use one because we go through our products every week. So a regular freezer will keep the biological allografts good for up to 3 months. We tell doctors if you're going to buy them, use them, don't just store them in the freezer. So if you buy a freezer that goes to 80 below, it's good for 2 to 3 years, but I don't know why you want to keep them. You want to use them. You can use a CR arm. That's for fluoroscopy, which is way fun, but it's something that's a lot of work. Ultrasound for injections. There's some good training classes if you want to use ultrasound if you're not confident with your anatomy. I try to use points that are simple for doctors to learn so they can learn their injection sites. Malpractice coverage we talked about earlier. Take care of your structure, protects you from assets. I had doctors approach me, when I was in Phoenix with Dr. Brimhall there. I said, well, we want to be partners. I said, don't be partners. You need to set up LLCs, C Corps. You need good advice is important to follow up with. And again, staff training is important. Make sure your staff is trained. Take staff to key trainings, weekly staff meetings. Make sure they understand all the procedures you're doing. You cannot have a misspeak to a patient, especially when you're using the biological allografts. They say the wrong things, you get the FDA in your office because of your staff members. That's a bad place to go. Cash for insurance, I talked about that. I've had doctors try to bill a lot of alternative cares to insurances. They get paid for a while. And I had 3 people in the last 6 months that are naturopaths in certain states that had done that, thought they were good to go. And then one got a bill from the insurance company for $400,000, one for $200,000 for services they decided and deemed were not necessary. If you're in cash practice, you don't even have that issue. Our system set up under Harper Chiropractic. We have DBS, Harper Restoration. Dr. Morris works under those systems. So he doesn't even actually work for the clinic. We actually hire his LLC to work for our clinic. And so it's kind of a complicated structure, and it's even more complicated here. We have our whole family trust set up, and Dr. Brimall can talk about what he has for his also. But neither of us own anything. And for asset protection, you want to look at not owning anything. People are so happy. One of my expertise is now I work with Nick Mick doing malpractice reviews. I've done 5 of them this year for the Northwest United States. And, I got to tell you, some of those people and attorneys are ruthless, and the less you own, the less of a target you are. So what do I do now? Decide to change the playing field, sit down and decide? Yep.
Dr. Harper, time out here a minute. You are the doctor that helps if a chiropractor or somebody gets sued. You come in and evaluate the case, and you were telling me the doctors that are getting sued the most are mixers or straights.
Most of them are straight chiropractors are getting sued.
Would you tell us why? That was fascinating to me.
Well, what happened we're finding is that the people who do alternative care do better documentation, better workups. They're better evaluators. When you get the straight adjusters, they're just adjusting subluxations. They're not informing the patient well, and they do a terrible assessment, and they don't recognize any risk factors involved. When you start doing injections, you're paying attention to a lot of things. I think it makes you a much better chiropractor. But we've had none of the doctors have malpractice cases for any alternative care in Idaho, and we've been doing it for 20 years here in the state.
Would you tell them?
That's a good question, John.
I don't know if you have slides on this, but would you tell them, take them through your 3-minute exam on how you know what to do for a patient, what, why, and how, by really evaluating them in a quick exam?
Well, I got the video that I was going to bring up and show them, which is 3 minutes, which makes it the easiest. And I can bring that up if you want to see that.
I don't know if it'll show on what we have going on here or not, but
it'll show. I'm sure it will.
So would that be good?
Take me a second to bring this up for you. And that's why I want to give the doctors that option to go into that and find that. Did I lose you there?
No, we're still here. While you're doing that, Dr. Harper, while he's pulling that up, I'm going to tell you, in every year we have a homecoming. We have people come in from all over this country and other countries. We had several different groups from the Caribbean this last year as well. And Dr. Harper had an hour last year, which we found out was not near enough. So he's going to be there not only evaluating patients and demonstrating out in the hallway, but he'll literally be having more than one class and showing this 3-minute exam and how he evaluates then what treatment he would render, chiropractic or innovative therapy to complement that. And I'm not bad at my 47 years of practice. I treated the tough of the tough cases, and I have him evaluate my tough cases and saw him get results very rapidly by going in using ozone or PRP, that type of thing. Now, a lot of doctors are afraid of doing that, and I've had people say, why all of a sudden are you talking about stem cells and biological allografts and ozone? With all these years, you've taught the 6 steps to wellness. And then as I get older, I'm 71 now, I don't want to act like a 71-year-old. I want to be running up and down the hills, and you find that your body heals a lot slower. If you had no stem cells, you'd be dead in 2 hours. So if my stem cells can only reproduce 200 in a month, what if I could reproduce 1 billion by doing some biological allografts? That's what I am doing. And I think it's important for us to realize we see cases every day that chiropractic can't help because of limitation of matter. You free up innate, but innate's tired, it's degenerated, it's MS, it's ALS, it's Parkinson's, it's all these horrible diseases people have named and blamed for their problems. But what if we can get physiology working better? And we know OHS nutrition, being whole food, organic, pre-digested, it gets in the system up to 300 times better than other things. But there's still people that don't get enough nutrition for the cells to regenerate, particularly as you get older. So that's why I have implemented this along with the 6 steps as Dr. Harris. So Dr. Harris, myself, Dr. Brett, Dr. Harper, at homecoming this next January, February, is going to be going into more of the practical application, the examination, evaluation. How do you see what you see? Where does this one just need nutrition? Where would this one be better if you're not going to do it yourself? At least know where to refer to. Well, what we don't want to have is, oh, I went to Brimhall, I never got results. But what if they went to Brimhall, they got 50% better, and he referred them to an integrated practice or had the integrated available there, and they were able to do some injections in key areas, and all of a sudden they went to a 99% improvement. That's the way I'm looking at things now. Dr. Harper, are you ready for that?
That's the integration is great. Now let's see if there's a play if you guys can see us here. This is a 4-minute exam. When we're observing a patient, even before they walk, just a standing state, we're going to Yeah, it's not going to download very good, John. But I want the doctors to go in and look at this these videos that are on here because they're really excellent for doing this.
That'd be great. Just go ahead and send that to us. Then we'll attach the link to the email that goes out for this, and they can watch it and not lose any time now. And they'll want to rewatch it and rewatch it. I mean, I watched you do it 7, 8, 10 people, and every time I'm impressed how quickly you get to where the problem is and how fast the patient can respond. That has been somebody else's failure for 7 years.
Well, I had a poor girl in today that's been to 3 orthopedists, a podiatrist, and her MD 4 years, and she had a leg that was a 1/4 inch short. Her foot was jammed up and locked up, needed adjusted. You know, just crazy stuff. And I think sometimes we get in a hurry, we don't look and take that minute. So the exam procedure would be great. And it's very simple. You go to Harper Restoration System and go to practitioner site and type in Harper, capital Harper, just capital H, and then Harper, and then 1, 2, 3, 4, 5, 6, and you're logged in. That's the password, and it'll go 4-minute exam. There are 68 videos on there, and write some new ones on all the time. So,
Shirley, if you please email that to me or text that to me, I'll include that when we send this out. Thank you.
Okay. I will do that, John.
Sure, we'll do that right now. She'll text you a text right now, Dr. Brimhall.
Thank you much.
And other than that, I really appreciate you guys all spending the time with me, ladies. And any questions I can ask, Dr. Brimhall, you can give them my number if they have any questions, call. And Shirley takes care of a lot of the technical stuff. She's a detail person. And that's her full-time job is helping doctors. Then looking forward to meeting all of you in the future.
I may have cut you off on that last slide. You may go back to that to make sure we didn't make you miss something looking at the exam there.
No, we're fine.
Okay,
It's all good. We're good. I think we've done what we need to do, and hope we got some good questions and responses. And I know I probably got more questions out there than there was time for answers at this point in time, but there's a lot of material. My class is like 22 hours, 2.5 days.
Dr. Harper is around the country teaching this, as is Dr. Harris. So Dr. Mark and I are only going to do about one every other month, where Dr. Harris and has also taken class from Dr. Harper, and we work together as a team to make sure you know everything you need to know. Why don't you just tell them briefly about how you will come into an office and train someone to this integrative practice if they're really interested.
Well, if they're really interested, what I suggest they do is take one of our classes. We'll be in Phoenix the 7th, 8th, 9th of June, and it'll be in Atlanta in August. And doctors, I suggest they do, if they have no experience with injections, start with the class first, get their feet wet a little bit, decide if they need to bring a nurse practitioner or a medical doctor in or a chiropractor in, depending on what you're looking at, and then see what your skill sets are and what box you want to build. If you want to do injections, if you just want to do biological allografts, you got to figure out what you want to be when you grow up. And then what you do is you will then call and talk to us. We'll kind of interview and see where you're at, what your needs are. And then, like, one of the doctors had done lots of injections, but he'd never taken my class. So he hired us for a day and a half to come in and see 10 of his patients, some of his more difficult patients. We did biological allografts with them and ozone injections with them. And he learned what I say, how I did it. We talked to his staff, went over procedures, and then we followed up with him with those patients for the next month. And then obviously now we get new patients every week. They'll give us a note, say, I got this patient coming with this. What do I do? How do I deal with this? So we do a lot of support care for you till you get your feet on the ground. And sometimes I talk to a doctor that I told them, I said, hire your nurse practitioner, then we'll train both of you and get you in line with it. So realize that's another situation to look at, is how much you want to integrate your office or not. And you can hire a nurse practitioner for 1 day a week in the office, and that's where you do injections 1 day a week. And that's a option, also works really well. So there's a lot of different options you can work with to make that work. So you can hire full-time or part-time or just hire the services. So that's probably what we do. So we're here for you, I guess what I'm saying. Whether you come through Dr. Brimhall or not, we help all of Dr. Brimhalls, and Dr. Harris's people that trained. So whatever you need, supplies, products, questions on hiring doctors. We're helping some doctors hire doctors and find doctors for them. So we got a big network we bring to the table. We want you to help a lot of people and be successful. That's the bottom line.
Absolutely, and that's what we see is it's just a good synergist working together. That's why we're implementing Dr. Harper and Shirley in our seminars, particularly the big homecoming ones, so we can get it in there and you can see what you want to do and how you want to do it.
And Dr. Brimall will make my email and website available to you, and more than happy to answer any questions for you.
All right. Well, thank you a lot. Thank you, Shirley, for helping set all this up, and Clark Tilley's crew. So good night and God bless you all.
Thank you. Good night. God bless.